Hello, everyone, and welcome to another episode of Mind Your Body and Soul, the Healthy Podcast. I am Joseph Ward. I'm rolling solo for a minute right now, but Matthias should be popping in any minute. And we also want to give a shout out to Miss Elena Steeple. She is our guest host from time to time that comes and interviews on the podcast and give us some of her insight. We know it's been a while, but remember, we work in the community. So a lot of times when we want to record, we actually have to be out in the community. But we do appreciate your patience and your kindness and just still being a part of what we have here at Mind Your Body and Soul here with Neighborhood Medical Center. So remember, Mind Your Body and Soul is an educational podcast that focuses on all things health related to help our listeners learn more about various health topics and information they may or may not have access to. We seek to inform, empower, uplift, and mobilize our listeners to become the healthiest versions of themselves. And Mind Your Body and Soul is available every Wednesday or most Wednesdays when we are not busy, on our website at www.nmcpodcast.com, as well as our Neighborhood Medical Center YouTube channel. Please subscribe. Go now. You're watching this on YouTube now, or if you're listening through any podcast channel, subscribe. Make sure you subscribe to the channel, like the video, comment, share it so more people can see it. And we're also available on Anchor, Breaker, Radio Public, Pocket Cast, Spotify, Google Podcasts, and so many more. So please support us. All right. So today we have a young lady on the podcast today who is a vital component when it comes to caring for people who are positive with HIV AIDS in this Tallahassee community. She works for our lead agency, Big Ben Cares. And when we're talking about client interaction, when we're talking about serving clients, a lot of time people talk about it from an aspect of potential or an aspect of ideal. But what we're going to learn today from this lady is helping clients from a first-hand experience, sitting down with people from various walks of life and being able to help these people get the resources that they need to improve their health and improve their overall quality of life, and sometimes not just for them, but for their families. So we're talking about meeting people sometimes at the highest point and sometimes at the lowest point. Meeting people who may not have all of the resources they need to get to the next step, but being human enough to help that person through those steps. And next thing you know, not only is that person reached the step that they were trying to reach, but they're beyond the step. She's been doing this for a while. And like I said, a vital component in what we do with our lead agency, Big Ben Cares, in conjunction with CarePoint, I bring to you Miss Melissa Walton. Welcome.
Thank you. It's an honor to be here. I've enjoyed watching this podcast, and I'm very excited to share some insight. But you already really said it all. So.
Well,
you called me young. Thank you.
We all are. But like you really play a key role. Big Ben Cares plays a key role. I don't think a lot of people really understand the role that you play, in particular in your position, but I don't think a lot of people understand the role Big Ben Cares plays, because street narratives and truth are two different things a lot.
Uh-huh.
And a lot of times narratives can be started because just, the telephone game, somebody tells somebody, and the message gets misconstrued. So that's why we want to make sure we have you on to get definitive information about yourself, but definitive information about Big Ben Cares and how others can access your services.
Okay.
Fantastic. So, yes, ma'am. So let's start with you. We want to know you. I always like to we humanize people here. We want to start with you. So can you give us some background information about yourself and why for the last 20 years you decided to serve your community?
Well, when I moved here to Tallahassee a very long time ago in like 1990, I don't know. I wanted to do something in the health education field and or work with youth. And they didn't have anything for me with youth. So I found Big Ben Cares and, I mean, what better job to go out and talk about sex and,
Right.
condoms and all of that other stuff. I mean, it was exciting. And so I started my professional career with Big Ben Cares, and I've done a little of everything with the agency. I've done health education, I've done volunteers and development. But in the meantime, I was going to school to get my social work degree. So I landed over I was a case manager early on, so now I'm over the case managers, and it is, I don't know, I've just always cared about the agency, about the community, about helping people. I've watched this community grow, by leaps and bounds. I mean, we still have an awful lot of growing to do, but we are now, on the corner of South Monroe. I mean, for years we were hiding in the shadows. So, I mean, we're kind of out of the closet, so to speak. I mean, it's it's been important to me. I wanted to care about, I wanted to work with people, and so I've been able to do that, and now I'm able to help a wonderful staff to be able to do that. So,
Right.
it's just something I always wanted to do. I wanted to help people, and I knew I couldn't deal with the blood and guts stuff. My mother was a nurse, or is a nurse,
Right.
so that was just the next best step, I guess.
Right. Okay. And so you say you majored in social work?
Social work, yeah. So I have a master's in social work. Um, and yeah, I mean, early on, I really wanted to work with the teenagers, but then it just rolled into working with adults. And
Right.
um, jumping into HIV and AIDS in the early 90s was very difficult because, because of the stigma, because of, people didn't tell anybody they were positive, people died. It was very difficult.
Right.
But and people were all very different than myself, but there it really didn't matter because we had a commonality to us with, trying to fight HIV in any way that we can.
Right.
And that just kind of helped break down whatever barriers that
Right.
we had. I remember early on, I used to go out to people's homes and, and we all watched the same stories. We all watched the same soap operas. So I used to do home visits all around soap operas. So we would watch a little soap opera, do a little business, talk about, because something to normalize what we were doing.
Right.
And it just kind of worked to allow us to find a commonality. So, now it's very different, because of course I don't really have a big caseload, but I meet with patients now as well, but usually it's when they have issues. Um, and what I've found is usually I just need to kind of keep my mouth shut and listen to, what their needs are, what their concerns are.
Right.
That took me a long time to learn, really, because a lot of times it's kind of that they're going to tell you what they need. All you have to do is listen. So, um, I still enjoy it, even though I sometimes get the people who are very frustrated by the whole entire system. Um, but I mean, we do things similarly to what you guys do, to what Bond does. I mean, all of case management is very much the same. Um, it's just someone to help maneuver a system that is very confusing.
Right. Right. So I want to pause that on that note about case management right now. We're going to come back to that because I do want you to get into that. I don't think people understand the importance of case managers. And I think case managers and social workers are very underrated. But Big Ben cares. So a lot of even before CarePoint was built, a lot of people ride down South Monroe. And you see Big Ben Cares on the left-hand side. Those of us who are from Tallahassee who have been here in the 80s and 90s, you know, that's the old firehouse building. So
Right.
we pass by it. We don't really know what it is. I'm from the south side of town. Before I start working in the public health realm, it was another building I passed by.
Mhm.
So for those who have no idea what Big Ben Cares, or for those who think they know, could you tell us what Big Ben Cares is, and how does Big Ben Cares go about caring for its patients and providing services?
Absolutely. So, I mean, basically, we're the local HIV and AIDS service organization. Now, it's kind of outdated because there's a lot of us who work in HIV and AIDS. But, you know, when you say we're the lead agency, you know, that all that really means is the funding that we receive goes to one particular agency in an area.
Right.
All of the areas of the state have a lead agency. So it doesn't really mean that we're the leaders, you know. I mean, people like to think that that's what it is, and like you said, the telephone calls and the gossip stuff. But we're no better than any other agency. We just happen to be an HIV and AIDS service organization. So, you know, we're providing prevention services in the community, and we're providing case management services for people living with HIV, just like Neighborhood is doing and just like Bond is doing. But you know, we also, just like Neighborhood and Bond, that's not the only thing that they do. And
Right.
now for us, now that we have CarePoint, you know, that's not the only thing that we do. So you know, it's obviously something that is needed with all three of us being here, because all three of us are extremely busy. You know, there's plenty of people who need us, plenty to go around, unfortunately. You know, I mean, it's not like we're fighting over people.
Right. Yeah, we definitely not fighting over people.
You know, I mean, I do think people need to understand that one thing that's really very good about this area is we collaborate really well.
Yes.
You know, I mean, we always have. And it is hard because sometimes we do go up against the same funding, but for the most part, you know, Bond, Neighborhood, Big Ben Cares, we all collaborate. We all can sit down at the table. We're all friendly with each other. We all can pick up the phone if we need something from each other. You know, our goal is to help people. And I think all of us do a very good job with that.
Yeah.
So for case managers, well, you want me to dive into that later, what we do
Well,
specifically?
we could come back to case managers, but
Okay.
kind of your position specifically, like because I know you're over the case manager. So
Okay.
what does your position entail, and how does someone really kind of get access to you as far as to receive your services?
Okay, so so my position directly, I'm over all of the client services, all of the services for people living with HIV. So I have 15 staff. I've got case managers, I have housing case managers, I have an intake coordinator, I have a couple transportation coordinators. We have 2 agency vans. And then I have 2 people who are peers. They're living with HIV, and they also provide extra advocacy and assistance.
Okay.
So if someone needs to reach out directly to me, they can call me. I'm at extension, 233, and I'm guessing at some point you post contact or something. I don't know, but but people can call me directly. I mean, most of the time I'm sitting at my desk and I return phone calls. But if you are looking to be a client, if you need services, you would either contact myself or our intake coordinator, Janette, and she is at extension 230. So we provide services to people living with HIV and AIDS who live within 400% of the poverty. So someone can make up to like $50,000 a year and become a patient. We need to have their proof of HIV, their proof of income, proof of residency, proof of insurance, kind of anything that you would normally have to provide if you were applying for money that comes from the federal or
Right.
the state government. Um, basically, once you become a client, then we're going to link you to whatever services you may need. We're going to assess where you're at, link you to services. I mean, it sounds really very simplistic, but it's really very interesting because you don't really understand how much you need case management until you have lots of things going on in your world and no one talks to anybody.
Right.
So it just really helps to have someone glue some things kind of together to help you move forward.
Right.
Is kind of one of the best ways I can explain. When my son had to have some medical challenges, he had like several different doctors and no one
Right.
knew what was going on with anyone. I mean, all it took was me just starting to email everybody to get everybody on the same page. And when you're in the middle of that kind of crisis or situation, it's hard to be able to do that for yourself
Yeah,
sometimes.
so that's where the case managers come.
Exactly.
Right.
And we help people to get to a place where they can do that by themselves.
Right.
So we have a lot of people who are able to do it by themselves, and then we have a lot of people who are very confused. And I also just recently adopted my daughter and had to go through the Department of Children and Families and all of that. Oh my gosh, I wish that would have happened to me about 20 years ago. I would have really had even more of an insight. I have more insight to what a lot of our clients and our patients have to go through, having dealt with personally having to deal with all of the things.
Right.
I always knew that it was very confusing, but now I've walked in those shoes, and that will make me better to train my staff to be able to help. I mean, that's all it is. It's really simply just helping someone who needs that little bit
Right.
of extra assistance.
Right. Yeah, because I think about case managers as people who have made themselves resourceful, have the right connections to people within the community, have the right information and experience to be able to guide a person along that path to help
Mhm.
help themselves. And I think everybody probably should have a case manager at some point in their life to help them with something. Because as I'm saying that, my mind is just thinking about different points in my life and just different points in people's lives. You need somebody to help you, and if you don't have anybody to help you, it's going to be difficult. And case management is that literally is your help to get from point A to point B.
Absolutely.
Yeah.
I mean, if you're looking for a resource for something, I mean, nowadays, if you need a plumber, you can go on Facebook or whatever and say, hey, I'm looking for a plumber. It's the same kind of thing. Or you pick up the phone and you call your family or your friends or you're this or you're that. You know, a lot of times with HIV, our folks they don't have a whole lot of people to ask that question to because
Right.
they really have not decided to share the fact that they're positive. They don't want to deal with all that emotion. So this allows them to be able to find out what they can do to help themselves out without having to talk to a family member and have to then disclose if they're not ready to
Right.
disclose, and so on and so forth.
Right.
Because
And
all of that is the whole emotional part, that we hadn't even touched on. I mean, there's that too.
but that's what I was just about to say. I think that's where the peer navigators will come in as well, because
Yes.
they have literally been in your shoes. So when the emotional component comes in, you have somebody who has some type of experience. Of course, it's not the same exact, but they
Right.
understand what you're going through and can help you emotionally as well.
Sure. Absolutely. Um, I have been amazed with how well the peers have worked. I mean, we've had them now. I think it's been, I don't know, 6, 7 years. I mean, it's been a long time, but yeah, I also I happen to have a deaf son. So, I remember when I first found out, the only people I wanted to talk to was someone who had, a child under 5 who was deaf,
Right.
period. Not one that signed, not one that, I wanted something similar to what I had. And that was a way for me to be able to process.
Right.
Same kind of thing. I mean, I know an awful lot about HIV, but I'm not HIV positive. So, I mean, not that everyone has to share their status, but I'm sharing that I'm not. So I fully understand that I can talk to you about things that people have shared with me over the last 20 years. But that's not the same, So that has been a wonderful, wonderful resource. In addition, a resource for someone who's like applied for food stamps or disability, goodness, Medicaid, that kind of stuff. I've never applied for those things. I've applied for financial aid, with college. I can help someone with that. That is a pain, but our peers also have participated in those kinds of things. So they're very good with helping people process that entire paperwork, which can be so overwhelming, so that has been a huge assistance with us having, because unfortunately, while our case managers certainly can help with that as well, they have caseloads just under 100, so it's a little hard for them to be able to take the massive amount of time it takes to be able to answer all those questions.
Right.
And not to mention, they wouldn't be able to do it with everyone. So, how do you pick and choose? So that's a huge resource that we have with our peer advocates. They help a lot with public assistance.
Right. And so how many total case managers do you have?
I have 10 case managers. So I have, wait a second, 10, 11, 12. I have 11 case managers. 2 of them are housing. 8 are regular. And then I have 1 that does both intake and.
Right. And all of them have pretty sizable caseloads.
Yes.
Okay.
Yes.
Wow.
All except, Janette carries caseload about 50 with her intakes. Everybody else is just under 100.
Wow. That's a lot. That's a lot.
Well, yeah, and what's really nice though is a lot of our clients are also patients with bond and neighborhood. So they have us providing case management and you guys providing case management.
Right.
And people are always like, well, isn't that too much case management?
No, it's not. It's not.
It's amazing how it's not, it's just not the same, I mean, Matthias might be working on how to get someone a colonoscopy, while Jamie, may be working on how to get, insure out to them, or how to get help with them signing up for food stamps or this, that, or the other. I mean, there really is enough for everyone to help.
Yeah, each agency is like its own maze, because I have dabble of experience in case management since Damali left. So I'm having to fill in a bit. And look, my hat goes off to all case managers. It's not easy, but just look at the different case managers for different agencies or different people, because every agency is a different maze, and every case manager knows how to navigate their particular maze.
Right.
But they all have to communicate as well.
Sure.
And if we're not working together on this case management level, you're gonna have a lot of clients fall out of care. So we have to be human, and we have to be adult. We have to learn how to put egos and everything aside and work with people, because it's not about us, it's about the clients.
Sure. Right. And then you also have to figure out a way to reach out to people who may not be ready.
Right.
Or try to help them to come up with their barrier as to why they're not ready. Which is never really all that easy. Because I think sometimes people don't even know what their barrier is, but sometimes it takes them, we'll reach out. We started doing this thing, we call it acuity. And for all intents and purposes, it's kind of almost taking your caseload and putting it in little sections.
Right.
You got, and there's like a questionnaire thing that you answer about each person. And this is supposed to kind of help you to make sure that you don't have someone fall through the cracks. So you got all the ones over here, and they're all the ones that seem to be doing just fine, and their labs are looking good. Maybe they've been a patient for a very long time.
Right.
Then you got the ones in the middle, and they need you to reach out to them at least 4 times a year.
Yeah. Yeah.
That you reach out. Now, they may reach out more often. And then you've got the high ones, and the high ones, you want to reach out to them once a month.
Yep.
And maybe you're just reaching out and saying, hey,
doing?
I'm here, and sometimes you really do feel like you're all up in their cookies, and they don't want to have anything to do with you. And that's true. And that might be what you do for a little while. And normally we're just kind of saying, we're here. We understand you have something that is preventing you from kind of moving forward. I want you to know I'm here, and I'm ready to help you when you're ready to be helped.
Right.
And I'm going to call you next month. Okay.
Right.
See you later. Bye. Click. And then, sooner or later, people either are going to no longer be with us because, they get closed, or we're going to bring them back into care, but they will remember that we've reached out to them.
Yep.
Because we care to find out, because unfortunately everybody, or fortunately really, but everybody's not in this cookie cutter kind of thing where they all do exactly the same thing.
Right. Exactly.
Everybody is very individual, and they all have their own issues going on. And a lot of times HIV is just this little tiny thing that's happening in their whole world of so many other things.
Yes. We're trying to get people to understand that. I'm especially working with people who are new into HIV AIDS prevention, or people who are on the outside looking in. So their mindset is, well, why won't these people come get their medicine? Why won't these people do this? Well, you ever consider maybe they don't have transportation?
Right.
They may not have electricity. Maybe life is happening and HIV is just at number 10.
Right.
And I have to, like, when I used to do the 500 501 trainings, I would tell people HIV is our highest priority because this is what we signed up for.
Right.
They didn't sign up to be positive. Right.
That's good.
But life is happening. So HIV is at the top of our list because this is what we chose and this is what we do. So let's find a way to, if it's not number 1 on the list, to make sure they understand you still need to pay attention to this, or make it easier for them to pay attention.
Sure.
So, yeah.
Absolutely. That's real interesting. I
Yes.
hadn't heard it that way, but that makes a whole lot of sense. That is right. We chose this. They did not choose this.
Right.
I'm going to have to borrow that.
You can have it.
I'll quote you.
So I want to ask this, just for clarity, because there are people who think they know, and there's an exact process. So if somebody finds out that they're HIV positive and they need to get into care, because Big Ben Care is a lead agency, no matter what, they have to come see you. So what are the steps in the process of somebody getting into care when they find out they're HIV positive?
Okay, so basically, we'll get a referral. Maybe it's from you guys, maybe it's from Bond, maybe it's from the health department, sometimes from the hospital. They're going to come to us. Now, if they're coming from neighborhood or they're coming from Bond, they're already established medically, which is fantastic. So all they're doing is coming in with us so that we can find them eligible for the services that are going to help pay for their medication mostly. That's really the only thing with that lead agency thing. I mean, technically, if they don't need any kind of wraparound services, they can go directly to the health department. But a lot of people like the wraparound services. They want, some extra transportation, some dental, mental health. The wraparound services are not a bad thing. So
Hmm.
people like that. So what they do is you'll contact myself or Janette. The patient needs to call. We'll do a brief kind of gathering of information on the phone and get them scheduled. And we will get them scheduled within 10 days. Usually it's before 10 days, but if things get super duper busy, it may stretch out into 10 days. That's kind of a requirement of the funding for us to get them in. Once they come in, they need to bring all of their information. This is the hardest part, is bringing in the information.
Hmm.
So, if they tested positive with you guys or with Bond or with the health department, we can often get the proof of their status from them.
Right. Right.
Then the proof of income, if they're working, is pay stubs. If they're not working, it can be like, let's say they're a student, they can bring proof of financial aid is kind of like a support. If they live with their mother, sister, brother, whomever, roommate, they can get a letter that says, this person's living with me and I'm providing support. That we can count as proof of income. We can count that as proof of residency too, if they make sure and put the address on there. The insurance part is really for our people who are working. So the state of Florida is going to require that you take your insurance if you're working full time and you're offered insurance. So you're going to have to show proof of that. That all gets kind of confusing, but when you call and we fill out all the paperwork, we're going to explain that all to you.
Right.
So all of that has to be done for us to be able to give you a notice of eligibility.
Okay. Okay.
From there, you're going to get assigned a case manager, and then you can get linked to services as you need them. Now, if you're coming to us, like say from the health department and you don't have medical care, or the hospital, if you have insurance, if the patient has insurance, they can pick whatever provider they want. If they don't have insurance, they can choose neighborhood, Bond, or CarePoint as the place that they can go to.
Okay. Okay. So is it harder to link patients to care who don't have health insurance versus the ones who do have health insurance?
Not anymore. It's not.
Okay.
The only thing I think that I would classify as hard is if you have someone who feels like they need to be seen immediately.
Right.
It's very difficult to get people in immediately, But then again, if I decided that I wanted to go see a primary care person, it would be hard for me to find someone, and I have insurance immediately.
Right.
I mean, you have to understand that all of the places that see people are seeing, everyone else in the community too. So, there's a system of how things have to go, and it takes a little while. Now, with that being said, though, test and treat, is a big deal. We're the protocols want people to get on medication very quickly after they find out they're positive.
Right.
If someone tests positive with us and they want to get on meds immediately, we're probably going to send them to the health department. The health department has, the test and treat. But I know that you guys and Bond both have referred people who have already started on meds as well. So we're calling all of that test and treat. And that seems to have been going pretty well.
Okay. Could you break down, just kind of give context to people what test and treat is?
Oh yes, I'm so sorry.
It's okay.
So test and treat is basically just what we call getting people onto HIV medication and right after they find out that they're positive. Of course, different people do it a little different ways. I don't know, does neighborhood require a confirmatory before you all do?
Well, if if it's a like a test and treat situation, we're not necessarily looking exactly for confirmation, but we do want to make sure they're started on something.
Okay.
So that's when we'll be in conjunction with the health department in that
okay.
sense.
Okay, good. Yeah. So the health department will assess someone. They'll start them on, whatever medication. There's a handful of them that are approved. Biktarvy is one that comes to mind.
Yeah.
And then they'll do labs on that person
Right.
and then get them referred. So kind of the clock starts ticking because, they only have 30 days of medication to be able to get into the system. So that's real important. When we do our little assessment on the phone, that's one of the questions. Are you test and treat? Have you started meds? So it's almost like when you give that, once you have shared that information and you pick where you're going for medical care, we'll want to make sure that they triage you in. We try to within enough time so there's no hiccup in between with the meds.
Okay.
Now,
So,
I know that we have, if someone was started on Biktarvy, I think we have like samples. So
yes, yeah, we
they
get
would work on doing something like that to make sure there's not any kind of interruption. It's best to share as much information as you can, during the phone interview to be able to make sure that we can triage you in as quickly as possible.
Well, that's one thing that we try to communicate to people the best we can when we're going out doing our educational classes in the community. Because of course, from that, we're not going to know specifically who may come to our office and may be positive, but we try to get the message out. If you give me as much information as possible, by the time you get here, you probably can be in care by the time you show up here physically.
Right.
So just being able to give us as much information as possible.
Well, it's funny because I was just talking to our housing case manager early this morning. We continue to have people who are guarded with sharing information, especially when it comes to income.
Mm-hmm.
HIV and AIDS is extremely gracious, I guess, with the income restriction. I mean, I don't know if y'all heard me early on, but you can make $50,000.
That's good. I'm glad so we're on the same page because I wanted to come back to that because you're talking about the ADAP program, correct?
Yes.
So just break that down with the ADAP program.
Exactly. Please. So in order, you have to make basically under 50, and that's just for one person. So right. I mean, there are many people there may be $50,000 in the household, and they have 4 people in the household. I mean there's something wrong with that. Well, we were having a challenge with housing because for our housing program, you have to do a budget, and what you have coming in has to be more than what you have going out. Well, we constantly have people who are not sharing their income, thinking they're not going to be eligible. They fall into that same thing. Now, theirs is 80% of the median income, so I think it's more like 38,000 or something. But it's so much more than
most people think.
Probably almost every single person who's getting housing. So. It continues to be very hard that people are afraid to share because they're afraid they're going to be denied because they have income. And that's a very hard thing to get across to people. Yeah. I'm not exactly sure how to cover it. Usually what happens is we'll deny them and then they'll be like, oh, I forgot. I have this income. And we're like, good. Now you're only delayed about a month.
But that needs to be echoed.
Yes.
Up to $49,000 to $50,000, you can still get assistance on your medicines and your care.
Absolutely. Yes.
And that's the AIDS Drug Assistance Program. So we have here in Tallahassee, there's an ADAP coordinator. So if you find that you're positive, especially when you go to Big Ben Cares. From there, at Big Ben Cares, that's when the process will start with the ADAP coordinator.
Correct.
So I try to tell people all the time, in this, Tallahassee has done a good job. Florida has, but Tallahassee has done a good job to making sure where it's really easy for people to access services if they have a good attitude about it and if they actually know where to start. And it's our job as the people who do outreach to get out in the community. We know we're not going to touch every single person, but touch as many people as possible so the information gets out. And like along with this podcast, hopefully as many people see this and they understand, if I'm positive and I need services, I have this range to be able to help me. Because like you said, a lot of people who may become positive will fit into that range to get services.
Absolutely. Yes. And you know, there are people who start with us and then they find that they don't need us anymore. I mean, that's certainly, you know, you don't have to become a client of ours and stay forever. I mean, there are
Right.
plenty of people who come in, get settled, and then, you know, they're good. And they move aside and the next person comes in. I mean, and if you need to come and stay and never leave, that's okay too. You know, the service is there for you.
Right.
And you know, it's always been that some people feel, I don't know, embarrassed or ashamed or angry that they have to get services. And because again, like you said, I chose HIV, they didn't. I mean, oh my gosh, it's just like yes, exactly. Well, all of that is true, but you know, we're also choosing to have this program here
Yep.
available to you.
Yep.
And you know, if you feel like you need it, we're here.
Right.
And if you don't, that's okay too. You know, but once you do decide that you want to be in the program, you know, we're going to then take on that responsibility to come, you know, knock on your door and say, hey,
Literally.
you know, we're still here and we still care about you.
Right.
You know, when you're ready, you know, or if we can help you in a place to be more ready, you know, that's great. I mean, like I said, I've been doing this a long time. I can tell you for years and years and years, I never had anyone come in and be like, I have a problem with drugs. Never, 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 never did I ever. And lately, I had one gentleman call me up. He was so excited. He was going into rehab, and he just said, you know, my body just can't handle it anymore.
Right.
I was talking to a gentleman who, you know, who was homeless, who is just ready to, he's ready to go down a different path, you know, and he was just telling me, he's like, you know, my body just can't handle the cocaine anymore. You know, I mean, I think that's no different really than some of us who may enjoy hamburgers, you know. I mean,
An addiction
as
is
you get older,
addiction.
you can't eat a darn hamburger every
Right.
single day.
Right.
You know, I mean, I know that seems kind of
But I get you,
simplistic,
because
but yeah.
but there's a parallel, because like I said, an addiction is an addiction.
Yeah.
And too much of something over
Yes.
a long period of time will break the body down, whether it's caffeine, hamburgers, drugs, or whatever.
Exactly.
It all have the same negative effect on the body.
Right.
So,
But yet, these folks that are coming back, you know, they've been around for a while, and then they're gone, and then they come back because they remember, oh, there is a place that, you know, that's not going to judge me because now I'm ready to be done with the cocaine, you know. Now that doesn't mean we're not going to say, hey, you know, all that cocaine is making you feel good, but it's also messing up your meds and your this and your that, because it is, because you're
right.
taking all these different compounds and putting them in your body. I mean, we're not judging you because of that. You know, I'm not, you know, judging. I have a gentleman well, actually, no. I had there was a bust of prostitution one time, and you know, and they posted it all in the paper, and there was like a dozen ladies, and 5 of them,
Yes.
were our patients. So what I did is I reached out to all their case managers and I said, now reach out to this person and just let them know that you have you have condoms available, and run through the whole thing about, unprotected sex and
Yeah.
what it does to them and what it does to others and sharing their status and all of that stuff. I said, I'm not judging you because you happen to be a prostitute. I want you, if that's what you're choosing to do it
Be
in
safe.
the safest way possible and without having to be arrested because you're not sharing your status.
Exactly.
And I know, that seems kind of backwards, but it's not like I can say you're not allowed to do prostitution and you're
Because
all of a sudden going to be like, oh, okay,
right, yeah, you can't. I can't stop you from doing what you're going to do. You're an adult,
Exactly.
but we can make you safe.
Yes, yes. And then someday you might be like, okay, I think I need to do something different.
That's what I. So my analogy that I use for that is, I say we're going to dig the hole. We're going to fill the hole up with water. We're going to bring the horse to the water. We're going to put the horse in the water and hold your mouth open. All you have to do is swallow.
That's right. Come on. Yes. And it is very frustrating because there are a lot of people that don't want to
Right,
drink the water.
but
Yes.
it's here. It's here. So okay. So with that being said, I want to get some clarity because
Okay.
there's an idea around the title of some people who are labeled as bug chasers. The people who believe that I can become HIV, or even I can contract HIV and just get disability and just get like help. How true or how false is that? And what states does a person literally have to be in as far as health or within HIV or AIDS to receive funding and help?
Pretty bad state.
Okay.
So, a very, very, very long time ago, it probably was a lot easier to get onto disability and onto Medicaid. Those days have been gone they've probably been gone for almost 10 years, 15 years. The last time I helped someone get disability, he was 55 and he had worked outside his whole life, and we had to fight with an attorney. I had to write letters about what his day looked like, and this was someone who had worked in the system and had money. I mean, he had money, he had worked all those
Right.
years, and it took about 18 months with an attorney for him to get approved. But then you have ones who, um, I can think of one gentleman who just recently, he lost his job with COVID and so decided it was a good time to try to apply because he had been just very sick.
Right.
And kind of similar age, I mean, and the reason I bring the age up is, of course, if you're 25 and you're applying for disability, I mean, I can't even imagine why anyone would give anyone disability unless you really have a very bad mental health challenge,
Right.
but physically, it is real rare for anyone to be that ill at 25. I mean, it still happens,
Yeah.
but really, really, really rare. But yeah, I mean, this particular gentleman, so he's been denied, and so now he can continue to fight, but it's going to take him 18 months. I went to a training one time with attorneys, and the people were talking about disability in general, and they were saying you will always be denied the first time, and it will take you 18 months to get disability, period. And I was like, really? Like everybody? Oh yeah, everybody. And that's, I think, because the system is so backed up. And now we've had, a pandemic where for a year and a half, the system got even more backed up. I mean, it could be taking them, I don't know, 2 years or more.
Yeah.
So
It's a process.
yes. So, I mean, chasing a bug just means you now are going to have more medication that you're going to have to take. And, in about 20, 30 years, that medication is going to affect your kidneys and your liver and, and while you're going to probably live a totally normal life, you're just going to have all these things happen to you a lot earlier than they might have.
Yes.
had you not chased the bug.
Right. Right. Thank you for clearing that up, because
There's nothing you're going. I mean, okay, yeah, you'll get a case manager. And while we are more than happy to help you out, if you have a good case manager, when you come to your case manager, you're 26, 30, and you've started on meds, and your CD4 count is fantastic and your viral load's undetectable, and you say, I want to apply for disability. Hopefully they laugh and say, ha ha ha. No, you don't want to do that, because that'll be just a complete waste of your time.
Right. Right.
Forever. I mean, yeah, and I will do that. I will tell people, please don't do that. Please don't waste your time. You will never get approved. Go find a job.
Exactly.
See, you are going to live.
You got
the meds that you have are going to help you to live. So go do whatever you were going to do living.
Yes. Thank you for clearing that up, because it's another narrative that's out in the streets that has been carried for a while, because a lot of people didn't know that particular service isn't really available anymore the way they thought it was.
Yeah.
And so I'm glad you cleared that up. So
yeah, I mean, my like I said, my peers will help you apply, but if personally, if I find out that that your labs all look good and you have no medical history whatsoever, you have no mental health history, you just think that you're going to get disability. You're not. You are never ever going to get disability until you're 65 or whatever it is these days, 72 or I mean, it's
just too risky to do that.
Yes. I mean, please, we want you to go out and have lots and lots of protected sex. Enjoy, Now you have PrEP available. I mean, PrEP is another, if you're high risk, it's something, it's a pill you can take that can help with the condom use. I mean, there's so many things available to help keep you safe. So much more than there ever was, back in the day, before I was married and wanting to, be safe.
Right.
I mean, the condom industry and all of that, they're trying really hard.
Mm-hmm. Yeah. The condom industry, birth control industry have done a great job of giving us the tools we need to keep ourselves safe. It's just on us.
Yes.
So as we wind this down, and this has been a great conversation, but I appreciate.
It's been fun.
Yes, ma'am. So from your perspective, what tips would you give a patient to help them better take advantage of the services provided? So they find out they're positive, or even if they're not positive, they just need medical care, medical help. What tips would you give the person to help find the best services possible?
So, make sure that you understand that you're in a relationship with whomever, whether it be your doctor, your, nurse, your case manager. And what I mean by that is, they're going to advocate for you, but you also have to advocate for you. So, if you're going in to see them, spend a little time to write down, because how we're busy and we think, oh, I want to ask about blah. Write that thing down, make sure that you've got your list of things. And if you are working with a case manager, this is your relationship with them. So they are certainly going to reach out to you, but you got to remember, you are one of an awful lot on their caseload, just like doctors, just like nurses. I mean, they're going to give you your individual time, especially when you have it scheduled. They're going to give you that. But you are one of a group of people that they help. So you have to also come to the table with what you need to do to be able to make that relationship happen. If you just think you're going to sit back and someone is just going to take care of you, case management is not babysitting. I mean, that is not our role.
Right.
You know,
Right.
and you are adults. You don't want to be babysat. You want someone to advocate for you, and learn how to join this relationship so that the two of you are advocating, because that is the thing that makes the best with your services. Be patient, breathe. I mean, I'm telling you what, this is my new thing. People will call up and be like, "Rah, rah, 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 rah," and I'm like, okay, we're going to breathe now. And
Yes. Yeah.
they're like, what do you mean breathe? And I'm like, we're breathing. Because not that I'm saying that this is not, it doesn't feel like it needs to be done right now, because it certainly does. But you have to kind of just relax a little to allow things to happen.
Right.
People get just, they if they get too excited, then other things tend to kind of start to happen.
Right.
So,
Right.
I encourage people, and every new patient I have ever worked with, I tell them, you are going to have a relationship. You need to tell your case manager what you need, how you like it. If you don't wake up until 11 a.m. every single morning, you need to tell them that.
Yeah, because I might call you at night.
That's right. They start work at 8. They're going to call you butt at 8:30. You're never going to answer the phone because you haven't said, hey, I don't wake up till 11. Please call me in the afternoon.
Right.
I mean, there's nothing wrong with that.
Right. Right.
But they're not going to know that unless you share that with them.
Mm-hmm. Now, you have to be your biggest advocate. And
Yeah.
if you can't be your biggest advocate, somebody in your circle, somebody who was caring for you, somebody who loves you, should be your advocate for you.
Yes.
And I'm once again, I appreciate this interview. I appreciate the way you delivered the information and the information you delivered it, because it's more in the practical way that people can get on the human level, on the everyday level. It's not something we're trying to put 17 letter words into. It's just everyday care for the everyday person, because we are on this side as far as providing care, but we live, work, play, and go to school in these same communities with these same people.
Absolutely.
Yes,
Absolutely.
so,
And thank you. I've learned valuable things, especially the part about I chose and they didn't.
yes,
I mean,
ma'am.
geez, see, it's just amazing. I've been doing this a long time, and I am amazed with how much I continue to learn.
Right.
And I think that's important too. I think
Right.
being open to learn things from the people that you work with and for
Exactly.
is so very important as well.
Yes, ma'am. Yes, ma'am. So, how can people get in contact with Big Ben Cares? How can people get in contact with you?
Okay, so our phone number is 850, because now you gotta dial 850
All
for
right.
656-2437. My extension is 233, and then Janette for new intakes is 230. So if you remember those two extensions, that will be good. If you Google us, the CarePoint number may pop up. We're housed with CarePoint. It's a primary care clinic downstairs. You can dial that number as well. Just remember extension 233 or 230.
Right. And websites and other information is in the description of this video. So y'all go down and click those things and be able
All
to
that
access.
info is on there. I think you can find me on there somewhere.
Yes. 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 You are the best. You are the best. Thank you.
Oh,
Thank you.
thank you for having me. This was
Oh, no
fun.
problem. Like I said, you're an integral part in what goes on here in Tallahassee. And if you guys at Big Care wasn't doing your job, it will make things a lot more difficult to get people into care. And so we want to make sure that you guys understand how much you all are appreciated and how much you are valued for what you bring to the table.
Well, thank you. I think, we all get, we get joy from working together. I mean,
Yep.
like I said, this is the job I've worked my entire professional life, and I
Right.
cannot think of doing anything different. So,
That's great.
you know, people touch my heart all the time, and I know I've touched other people's, and, you know, and it is a joy to work with this community, you know, like you guys.
Yes,
It's a
ma'am.
joy to be on your podcast.
It's a joy to work with you guys. So
It's
look,
so
and that's
progressive.
and that's why we call this Mind, Your Body, and Soul, because it's a holistic approach to taking care of our patients. So once
Mhm.
again, Miss Melissa Walton. Yes, ma'am. So remember, this is Mind, Your Body, and Soul. This is an educational podcast that focuses on all things health related to help our listeners learn more about the various health topics they may or may not know about. We seek to inform, empower, uplift, and mobilize our listeners to become the healthiest versions of themselves. Subscribe to this channel, like this video, share, leave your comments in there as well. Remember, we're on the podcast platforms: Anchor, Breaker, Radio Public, Pocket Cast, Spotify, Google Podcasts, all those things. So with that being said, once again, I am Joseph Ward. She is Melissa Walton. Melissa Walton. I'm all tongue tied now. We've been talking, tongue trying to stick to the top of my mouth.
Uh-huh.
But thank you all. We'll see y'all next episode. Peace out, people.